working for you in the spirit of Arkansas. This is Channel 7 News at 6 in high definition.
Tearing an ACL is a typical problem for athletes, but doctors are seeing more sports injuries in kids as young as 12 or 13. What you can do to protect your kids, coming up tonight at 6:16.
Well, summer is a great time for kids to run around outdoors.
That's for sure, but that also means a greater chance for kids to get hurt. What you can do to prevent injuries, coming up at 6:16.
An ACL is a common sports injury, but what's not common is when the athlete who tears it is only 13 years old.
Scott Inman has more on the increasing number of major sports injuries in kids in tonight's Health Check report.
Stephen Holmquist lives and breathes soccer, but for several months he couldn't play after suffering a major injury.
I had taken a shot and I was going to make sure the goalie didn't drop it because he had earlier in the game and I'd scored off that. And I was planted and I stopped and my knee just hyperextended and I was out.
And when Stephen says he was out unconscious. He woke up to find out later he had torn his ACL as well as both menisci.
I think we're seeing a lot more ACL tears in younger athletes, especially what we would call skeletally immature adolescents. Those are the kids that are still in the rapid phase of growth but have not completed their growth. They haven't achieved their final height.
And Dr. Pruitt attributes the increase in injuries to the higher level of play that kids are competing in at earlier ages. And the risk can come with consequence.
If you're 25 and you have part of your meniscus removed, it may not be that big of a deal, but if you're 13 or 14 and you have to have that same surgery, that's pretty much certainly going to lead to some arthritis down the road.
Dr. Pruitt says there's not a lot you can do to prevent ACL injuries outside of playing on the right surfaces and wearing proper equipment. He says some research suggests hamstring strengthening exercises may help prevent ACL injuries. After months of rehab, Stephen now wears a brace but is back on the field and has no plans on slowing down.
You're going to take soccer, you're going to keep playing as long as you can?
As long as I can.
And Dr. Pruitt says kids' injuries are more common in the summertime, which we are headed into right now. He says make sure your kids have the proper safety equipment, teach them common sense, and put them in the right environment to stay safe.